Please understand that this is a general discussion, and there may be some specific features of specific surgical procedures that might result in different recommendations. Please view this video only as an enhancement, not a replacement for other conversations. My philosophy continues to be, if you are worried, I'm worried. If you have questions or concerns, I would much rather you call the office or submit our question through our website. After surgical treatment of your broken wrist, you've been placed into a splint. This splint is designed to stay on until you are seen back in the office for follow-up. Hopefully it is positioned so that you have maximum motion of your fingers available. When I think about the ultimate outcome of wrist fracture surgery from the patient perspective, it is absolutely critical you achieve essentially normal finger range of motion. I know it will hurt, and you certainly do not have to get back all the motion in just a few days, but your finger motion ought to be your #1 priority. Oftentimes, the easiest way to get them moving is to use the good hand to take the fingers on the injured side one at a time through a full range of motion. As you become more comfortable, you will progressively be better able to do this motion actively with those fingers as well. Due to the location and path of the tendons to the thumb usually hurts the most initially and takes a bit longer to recover. It is normal for your fingers to be swollen. In addition to working on motion, another good way to reduce swelling is to keep the hand elevated. I like to call it the Statue of Liberty position. In bed or on the couch, if you prop pillows up so your fingers are up and your elbow is down, that will be helpful. It is normal for there to be some pain further up the forearm than the surgical site. Often the muscles of the forearm can get a bit unhappy from the fracture plus surgery. If you are doing a good job of keeping the hand elevated, you may also become a bit black and blue further up the arm as well. Okay, let's talk about bathing, of which I'm a big fan generally. The splint is not designed to get wet, and we want the incision to have some time to heal and rest. You can bird bath all around the splinted area, or many patients find that wrapping hand to elbow with saran wrap and then also using a rubber band at the top and bottom can work well. Better than the old garbage bag approach. Even with the saran wrap technique, however, you do not want to immerse the arm in water or have the shower spray the area directly. Pain control issues. A good technique is to alternate ibuprofen with the prescribed pain medication. As long as you do not have an allergy, sensitivity, or other medical reason not to take ibuprofen, adults can take 600 to 800 milligrams of ibuprofen. 4 hours later, take 1 to 2 tablets of the pain medication. 4 hours after that, take ibuprofen again, and keep alternating. This has proven very successful for our patients. Remember that the first 2 to 3 days after surgery are generally the worst, and the next phase of pain often lasts up to 2 weeks. Things generally will get better from there. Almost all of the prescribed pain medicine, Percocet, Vicodin, Tylenol #3, Norco, have Tylenol built into the pill. Please do not take extra Tylenol in addition to these pills. I do not generally have patients start physical therapy for the first several weeks after surgery. As long as you are making good progress with the motion I described earlier, I have not found substantive benefit in starting early. Some of my patients ultimately choose not to go to therapy at all and simply work on things on their own. If you feel strongly, that is fine. We will give you the prescription at your follow-up appointment. Note that some insurance plans require authorization, and that sometimes that authorization can take some time before therapy is actually approved. This video is not meant to be exhaustive. It is normal and expected that other questions can and will arise. My goal, and the goal of OrthoArizona, is to get you back doing the things you need to do and like to do as quickly as possible, and as safely as possible. I honestly wish I could guarantee every patient a perfect outcome on every front. But as I have likely told you in the office, I have not yet been made all-knowing and all-powerful. I look forward to seeing you in the office in follow-up. Again, if you have any concerns sooner, I want to know.